As you get back to your counties, as you get back to your areas that you live in, your communities, encourage our people in the villages, encourage our people in our homes, in our estates, to register, to come forward, and those who are determined to be poor and in need of those services. 1 million households, I'm talking about 4 million Kenyans, will now have access to the NHIF cover, meaning they will have access to these services that we are discussing today. However, I have heard your call. I have had the call on extending these services beyond that. I've had the call and the celebration that yes, dialysis was important, yes, dialysis helped, but we need to extend this further. And again, here I'm proud to announce 2 more initiatives that are underway through the NHIF UHC scheme. The first one is, for the first time ever, NHIF will actually put in place mechanisms to encourage the prevention and promotion of healthcare, focusing on NCDs. What this means is that through the new UHC scheme, which we will soon be sharing with our practitioners, some of you I'm sure may not have heard of this, but the new UHC scheme will actually have a component for screening within it. We will actually pay for you to be screened. And what will happen, obviously, is that our healthcare workers will start encouraging Kenyans to come forward for screening services. And that, therefore, will lead to us ensuring that we are getting these diseases earlier, and we are able to actually avoid progression towards the need for kidney transplants. And that's one intervention we are putting into play. And I really want you guys to hold us accountable. I want you people to make us work. Come forward. If any of you are to benefit from that program, if any of you are already in the NHIF program, there's actually a free annual screening package available, where you're able to have your physical checks done, your lab works done. So we want to encourage all Kenyans really to utilize that facility because it's available. The second intervention, as we speak right now, and this was intimated by Dr. Benjamin, is that we are currently reviewing what is known as that benefit package for NHIF. And one of the components that we're looking at is, yes, the discussion that was held in the Kenya Renal Association meeting. How can we put in place a mechanism to actually finance post-transplant care? And I've seen the actuarial studies, I've seen the numbers, we are crunching numbers, we are presenting these to Treasury. And in fact, there's some good news. Next year, there's going to be an inflow of almost 12 billion shillings more coming into NHIF. So I'm sure some of these measures shall be computed and shall be addressed, at least in the coming financial year. So these discussions are underway within the Ministry of Health and also with NHIF. The second other element that I've had is on supply chains, our medicines and products. I take note that post-transplants, there's a lot of care when it comes to, the drugs and ensuring those are available. I've had the same call to the CEO to be able to ensure that there's actually availability of drugs here due to the costs of those medicines. Again, there is an initiative underway through the President's directive to ensure that we actually put in place mechanisms to ensure that we are regulating the price of medicines and costs. And so what we've done as the Ministry of Health, working with county governments, there's now a committee that is sitting to come up with a mechanism of how we shall reduce the cost of medicines.